Hi, everyone. Thanks for joining. We're going to hang on just a minute while everyone rolls in. We've got quite a few people, I think upwards of 500 folks who registered for our webinar today. So we're going to have just a little bit of time here and let everyone roll in here. So just sit tight for just about a minute while we get those people in and able to hear and see everything. And we'll be with you in just about 60 seconds. I was going to say it looks like it leveled off, but we're still seeing quite a few people rolling in here. So I'm just going to give them a minute to get in. Again, we have a pretty large number of registrants today, so it takes a little bit of time for our system to kind of let everyone in the door. So appreciate your patience, but we are going to get started in just a second here. All right, I'm going to say that looks like it's leveled off a bit. I'm sure more folks will continue to roll in, but want to respect everyone's time here and get us going. So thank you everyone for joining us today for our webinar, Tucker's Law and Best Practices in Youth Substance Misuse Prevention. My name is Brooks Ballard. I'm Vice President of Operations at Catch Global Foundation, and I'm delighted to be your moderator today. So we're excited to kick things off, but as usual, before we begin, I'd like to cover a little bit of housekeeping. First, this event is being recorded. The webinar recording and a PDF of the slides will be accessible on the Michael and Susan Dell Center for Healthy Living and catch.org websites. All registrants will also receive the direct link to that posting via email as well. If you have questions during the presentation, please enter them into your questions chat box for a Q&A at the end of the presentation. We will try to hold those for the end. If something timely comes up, we may jump in, but for the most part, we're going to try to just kind of organize those and we'll have some time for Q&A. If you have some troubleshooting assistance needed, please message our hosts. You'll see Michael and Susan Dell Center for Healthy Living there, and they can try to help you troubleshoot. I will say from experience that usually the simplest solution is just to leave and rejoin if you're having any technical difficulties. That usually works out the kinks in my experience. So now it's my distinct pleasure to introduce our speakers for today, Marcella Bianco and Dr. Steve Kelder. Marcella is the Director of Government Partnerships for Catch Global Foundation and has led our team's efforts around the Catch My Breath Vaping Prevention Program, which was created by our other panelist, Dr. Steve Kelder. Marcella has almost 20 years of experience working in tobacco prevention and control, going back to 2005 when she worked as the South Florida Field Director for Floridians for Youth Tobacco Education, where she helped successfully advocate to restore funding for youth tobacco prevention through legislation that amended Florida's constitution. In 2017, I believe I got that date right, she joined the team at Catch, where she's led dissemination efforts that have brought Catch My Breath to more than 5,500 schools across the country, reaching nearly 2 million kids. So welcome, Marcella. Our other panelist, Dr. Steve Kelder, is the Beth Toby Grossman Distinguished Professor in Spirituality and Healing at the Michael and Susan Dell Center for Healthy Living, UTHealth, Houston School of Public Health in Austin. With a career spanning over 3 decades, Dr. Kelder has gained significant expertise in designing and evaluating research programs focused on child and adolescent health. His particular emphasis lies in developing interventions aimed at empowering youth, schools, and parents. Dr. Kelder also served as a senior scientific editor of the 2016 Surgeon General's report on e-cigarettes and is a nationally recognized expert in youth tobacco prevention. As I mentioned, he also played a pivotal role in, he formed the Catch My Breath program and played a pivotal role in the formation of Catch Global Foundation. Also amongst his many accomplishments was, being the advisor to one of his most successful students, me. So Steve, with that, I'll hand it over to you and let you take it away from here.
Thanks, Brooke, and you were an excellent student. I'll let the audience know. So thank you very much. I'm going to just run through a couple things about our Michael and Susan Dell Center, which is the center that I live in. And we're inside of the University of Texas Health Science Center School of Public Health. Our main campus is in Houston, but I am in Austin at a smaller regional campus. And here's our motto: we advance health and healthy living for children and families through cutting-edge research, innovative community-based designs, and dissemination of evidence-based practices. I'm going to go back up to this slide just to say that this is our aspiration, is for healthy children in a healthy world. We do a lot of nutrition research, as you can probably tell, as well as physical activity work too. And what we do is develop programs, test them to see if they work, and then we hand them over to the Catch Global Foundation, where Brooks works, and they disseminate them. It's a great partnership, public-private. And so center resources, if you visit our website in the bottom right-hand corner, that QR code, go ahead and snap a picture of it and visit it. You'll see websites, webinars like this one, newsletters, blogs, social media, research, and Texas Child Health Status reports and toolkits. If you're a legislator, if you want to just know more about legislation related to children and health, scan the top left corner QR code, and we have a number of legislative initiatives. And in a nutshell, what we do is we have surveyed a number of our elected officials here in the state of Texas, and we talk to them and we offer them expertise in the form of they can ask us questions, we'll look in the literature, and we will give them back evidence-based answers so they can make better decisions as they're conducting their processes for evaluating legislation and deciding whether to enact it. So that's what we do at the Center for Health Promotion. An upcoming webinar is Best Practices in Youth Nutrition Education. That'll be by Sandra Vandenberg. She's an international expert in children in health and nutrition. So I'm sure that'll be a fantastic webinar that's coming up. So let's get into Tucker's Law. It's House Bill 3908. I want to say, if Representative Wilson is here, thank you for carrying the ball on this one and getting it passed, and Representative Creighton too. This 3908, so you're the enrolled version. That if you go to texas.gov, you'll be able to find it. You know, it's more than fentanyl that Tucker's Law talks about, but it was fentanyl that stimulated things with the Rowe family. And so I'd want to thank them for their hard work in working with Representative Wilson and Creighton. Fentanyl, as it says in the slide, is a drug trafficker's perfect drug. It can be made by a single person in a lab with synthetic drugs. So unlike marijuana, where you have to plant you need land to plant crops, or poppies to get opium, you just need some synthetic drugs, and they can be delivered to you. It comes mostly from China, a little bit from India. It's very small, as you can see on the tip of the pencil. That's very much enough to get high, and for some people it's enough to, it's probably too much and you'll overdose. What this means is it's difficult to find the manufacturers, and it's very easy for them to transport them. Little tiny things. It might be mixed with cocaine, it might be mixed with heroin, it might come in the form of tablets. The tablets might look just like other commercially available tablets from pharmaceutical firms, and so it makes it very challenging for drug interdiction. But I'll talk more about that as we move forward. And so just a little bit about Texas. I know most of you are from, or I think most of you are from Texas. Last year, more than 2,000 lives were lost to fentanyl in Texas. The total in the United States is 80,000 lives lost in Texas. And so Texas is doing better than other states. A lot of the problem you'll see in a couple slides is up in the Midwest and in the Northeast, but it's starting to cover the country. Texas alone has seized 380 million lethal doses of fentanyl since 2021, just in 3 years. And that's enough to kill every man, woman, and child in America. So if you didn't know that this is a big problem, it's a big problem. And it's a big problem here in Texas too. That's a lot of drugs that they've done. So let's give a little shout out to the DEA and Texas agents. Another shout out to the Rowe family. I mean, they, unfortunately, their son had a a problem, I guess, with this drug and took it. I don't know the circumstances of it. What I do know is that they have a website like this, and you can just see some other people that are in Texas who died from overdose from this drug. It's a very, very potent drug. It's a very bad situation, I think, that we find ourselves in. And I give the family of Tucker, the Rowe family, a lot of credit for pulling this website together and talking to the elected officials and getting this bill passed. Basically, what the bill says is, if you don't know, in Texas, in other states, we have a Texas education code. And in that code, there's requirements regarding health that schools need to teach. And it's broken down by elementary, middle, and high school, and then every single grade, up and down. And Tucker's law pertains to kids in, I think it's eighth grade through 12th grade, a little bit of middle school, and all the way through high school. And it requires that the teachers that are teaching health provide some form of suicide prevention education, prevention of the abuse and addiction to fentanyl, our main topic today, awareness of school and community resources, and health education about substance use abuse, including youth. This could pertain a lot to youth and young adults as well. I also want to thank Texas, in a way. Governor Abbott signed into law 3 other related bills in 2023. House Bill 6 makes it a criminal offense of murder for supplying fentanyl to somebody that results in a death. That is a change. And so if someone's caught giving someone else some fentanyl, and if they die, they can be charged with a murder offense. It enhances the criminal penalties for manufacturing delivery of fentanyl. It requires deaths caused by fentanyl to be designated on the death certificate. Now we're getting into my field. That's an epidemiology thing, and it's a state health department thing. But we all get a death certificate when we die. We all get a birth certificate when we're born. And an underlying cause, if it's fentanyl, needs to be on that death certificate. And me as an epidemiologist really likes this, because we'll be able to look at the deaths and see exactly how many are on the death certificates year by year by year, and sort of track that to see how we're doing. It's a great thing that their Representative Goldman and Huffman did. Senate Bill 867 allows for distribution of opioid antagonists, including life-saving Narcan, which is also known as naloxone, to Texas colleges and universities to prevent opioid poisonings. I believe we spent Texas purchased and delivered 50,000 Narcan kits to high schools and universities throughout the state. And Narcan, what it is, if you're ODing and you're in a possibly death situation, the Narcan will counteract the actions that are happening with opioid. That's what antagonist means. And that is a lifesaver, the Narcan. We'll talk more about that too. And then 3144 by Lujan and Campbell representatives establishes October is Fentanyl Poisoning Awareness Month. So the parts we just talked about, the Tucker laws requiring suicide prevention, and these additional laws, I think, means Texas is taking this problem seriously. And you're going to see some data that will convince you maybe even more. I also want to let you know, this is a personal cause for me too, not just the Rowe family. My nephew, Max, pictured here in multiple pictures, passed away from, he did have an opioid addiction, and he took too much and overdosed and died. It's just a tragedy. And my sister in the top left-hand corner was supporting him for so many years. And so I have a firsthand, at least, not as much as Nancy, but I have a firsthand experience with the devastation that can happen to a family and to a person. You know, in a way, the enemy of progress in opioid substance abuse addiction is stigma. And with stigma comes prejudice, and people often think it's not my child, it's not my problem. But people with addiction, they make terrible mistakes. There's no doubt about it. They make really bad mistakes. But once you're addicted, it's so hard to get off of. And so what we want to talk about today is prevention and treatment. And so we can do our best to stop this. I'm not going to talk a lot about interdiction. That's a police and DEA issue. But people with addiction, it's not a character flaw. It's not a choice. It's a disease. And we need to think about it as a disease to reduce the stigma, I believe. It's difficult to talk about. It's difficult to face. It's uncomfortable. But we need we need more compassion from people who are not in family situations like this, in my opinion. Addiction's a treatable disease, and treatment saves lives. Addiction is a preventable disease, and that's the main thrust of this talk today, is about prevention. And we need to start by informing parents, kids, and schools, and that's just what all these laws did. And so good on Texas and Governor Abbott for proposing these laws and passing them. So here's the deal. If you look on the left-hand panel, US drug overdose, you can see all opioid related, not all drug overdose and deaths is near 110,000. Fentanyl peaked at around 80. This is 2023. I'm not sure if it went up. I don't think we have the data from 2024. But anyway, fentanyl, you can see, started, almost looks innocent, doesn't it? Back in 1999, and it just snowballed up over time. And it also increased at the same time when heroin was going down. And some people think it might be a result of the drug laws, which made it much harder to get their hands on opioid painkillers. And that opened up room for a black market. That's debatable, but many people do think that. Whoops, what happened here?
We still see the slides, Steve.
Oh, sorry, I clicked something and it took me to another place. So overdose deaths, you can just take this and break it down by American Indian, Black, White, Hispanic, Asian. The main point here is, again, 1999, very low use, and then escalating, and then in the around, looks like 2016, 17 or so, it just rapidly accelerates, especially amongst American Indians. It was escalating all along for whites, and then African Americans caught all the way up to whites. Hispanics, it's also on the uprise, and in the Asian community too. So this illustrates how many people, of course, this is all the United States. I don't have a lot of Texas only data, but it says the problem is big, it's prevalent, and it's deadly. And so here's the spread of these overdose fatal deaths by fentanyl per 100,000. You can see in 2013, not too much, between 0 and 10, maybe up to 20 per 100,000. 2022, just 9 years later, we see enormous shifts in the trends over time. Oops, come back here. And when I found this, as I prepared for this presentation, it really did make me stop and think. So look at the big old box. That's how much heroin you need to basically to get high. So you need that. Fentanyl, you need 1/50th of the amount. And these other drugs, which aren't necessarily out in the market just yet, but are now being discussed as a possible third, fourth, and fifth type of drug with fentanyl as a potential problem. And so the bottom one is 1/500th of what's necessary for heroin. And the main point in this slide is that there are even worse drugs out there than fentanyl. And this requires careful documentation of its spread and growth across the country and by state and by racial categories and income categories, so that we can monitor it and see, is it going up or down? And the interdiction studies help us know what's happening. You know, I live near I-35 here in Austin. In the pharmacy school, I went to talk to someone. His main area of research is when the police catch a truck, he sends the research team over to find out what's in the pills. And so you can do this with natural drugs, what you see in the National Health Store, natural, but also with these other drugs. And with that, I'll say that those studies from the guys I talked to over at the pharmacy school, laboratory testing of drugs seized by the DEA, 7 out of 10 have a lethal dose, potentially lethal dose of fentanyl. DEA collected 75 million pills to date in 2023, then exceeds the previous years in 2022 at 58 million. So here we see some evidence that the problem is growing, or at least the DEA is seizing more of it. It's kind of hard to tell, but still a big problem. So federal funding for drug control is doubled since 2008, trying to stem the tide of all of this, which I've just talked about. In 2021, the government spent more on treatment and prevention than to trying to reduce the supply. And so what that means is there, with the increase in funding, there's more funding available for treatment and prevention, and the interdiction for the DEA or other types of reduced supply has remained about the same and slightly larger. And so it's great that treatment and prevention are being prioritized. Federal government is also making it easier for people to get their hands on proven treatments for opioids, not people, doctors. Methadone, buprenorphine, excuse me, and Narcan. And so another fun fact I found out that Texas in lawsuits against Allergan, CVS, Walmart, and Walgreens brought $3 billion in. So now we've got the federal government offering more money, Texas having more money. And that, I hope, will turn into increased catching the criminals, which are driving the pills up I-35, as well as funding for treatment and prevention. And so Texas has the highest absolute number of people in the country that living outside a 10-mile radius of a waivered clinician. What a waivered clinician means is that you can actually give them methadone, patients methadone or buprenorphine. And those two agonist drugs are also street drugs. And so there's a limit, or physicians need to get themselves and their clinics waivered to be able to prescribe these to patients which have addiction. And this is a bottleneck for those who are addicted and for patients. And we can see in Texas, it has the biggest number of people that are 10 miles away from a waivered clinic. 10 miles doesn't sound too big in Texas. We drive across the state often. And so that's almost 1,000 miles, but still it might be too far for someone who doesn't have a car, who has difficulty getting around town. Just another thing, we need more waivered clinicians to work on the addiction side of this problem. And so what should we do? I think we need to know what's going on this chart. And so small pinpoint pupils, pale face, feels clammy to the touch, body is limp, fingernails or lips look purple or blue, there's vomiting and gurgling noises, can't be awakened, unable to speak, breathing, heartbeat slows. And here's the actions. Call 911 right away. Try to wake the person up, give them the Narcan if available. And this is probably the key thing. And that's why the state is purchasing kits and sending them to college and campuses all over the place in high schools. It's mainly a problem of youth and young adults. You need to turn the person on their side to prevent choking, and then stay with the person until emergency services arrived. And these actions were what my nephew Max didn't happen to have. Anyway, so let's get into prevention a little bit. Delaying substance use initiation reduces later risk for substance use disorders, and overdose. So we do have successful science-based programs to reduce substances. But on the other hand, substance abuse alone is not, I think, what needs to happen to be able to reduce the risk, because substance use is associated with using other substances. If you use one, if you start with vaping, you might go on to cigarettes, you might go on to alcohol, you might go on to marijuana, you might be now in a situation where you find people that you're getting the alcohol or drugs from, and they might offer you fentanyl, or they might offer you heroin, or they might put fentanyl in the cocaine so that they can use less cocaine, which is more costly to produce than fentanyl. Sometimes they put in too much, and this is the problem with the overdose. It's also associated with delinquency, probably because you're hanging out with other delinquent people, or you're buying substances which are illegal. It leads to disaster academically, teen pregnancy, sexually transmitted diseases, penetration of, experience with violence, injuries, mental health problems. And so the point I'm trying to make is that substance use is associated with a whole bunch of other things that doesn't help society, doesn't help the individual, and causes panic and grief amongst families. And so what should we do? You know, I don't want to tell anyone how to raise their kids, but these are some scientifically based things that we do know, best practices. So best is be a good example. around your kids. And I think you know what I mean there. And so know your teens' activities and whereabouts, and know their friends and know their friends' parents. For some people, this might sound really hard to do, like pick up the phone and call the parents of my kids' friends when they say they're going to be over there at a sleepover or just going out on a Friday night. But these activities, knowing the whereabouts and the friends and parents, are critical in getting into the child's head that you care about them and that you're going to follow up with them when they leave the house. You need to establish rules and consequences. And so some rules could be coming home for having a curfew for coming home, or leaving a party where there's alcohol or drug use. Like if you see this, you need to bolt. You need to get out of there. Or definitely not to ride in a car with a driver who's using alcohol or drugs. On the other hand, overly harsh punishments can definitely backfire. So if you say you're grounded for a year, kids aren't really going to take that seriously, and they might cause another conflict between you and your child. And so there's guidelines on what the right punishment is. I can't get into it in this talk, but if you can find that on the internet. You also need to keep track of the prescription drugs at your home, at your aunts and uncles' home, at your grandparents' home, so that the kids can't just take some. And that might be the beginning of the fuel that fans the flame for larger amounts. And this does sound kind of simple, and it relates back to the very first slide where we had fruits and vegetables. Do something fun. Having a garden is fun. There's many fun things to do. But those are some evidence-based best practices that one can try to do within your own family. But fentanyl specifically, it's about having a conversation. It's time to talk a bit about fentanyl. It's calm, direct, no judgment. The plan is to stay safe, not just for your child, the child's siblings, and their friends, and explain some of the dangers that I've just talked about substance use. And to let them know, certainly in high school, that Narcan is a medication that can reverse overdose opioids and fentanyl. And it's available in many pharmacies without a prescription. So you can have some at home. If you think you live in an area that's high risk, or if you think your children are with kids who are high risk, you probably need to get a little Narcan at home, just to try and save someone's life when they do something terrible or make a really bad decision. Now I'll talk a little bit about the Catch Global Foundation. And Brooks mentioned that I helped start this with another exemplary student, Duncan Van Dusen. He and I went on our way to start a foundation that has the intent of disseminating and making easily available different programs which are created at UTHealth. And many of those are my programs, but not just mine. And so we do comprehensive health within a framework called Catch Health Ed Journeys. What we're trying to do with this list on the left is what I showed you before or talked about before. Substance use just doesn't happen in isolation. And so if you get kids very interested in PE and get them more fit and get them with activities that they like to do, they're less likely to fall into the substance use category. If kids who are healthy with healthy food, they're better able to, if you look on the right side, attendance, achievement, and well-being. Social emotional learning, if we can help kids learn how to relate to know themselves, but also relate with others with some degree of empathy and understanding, that helps your child significantly. It also helps your grades, by the way. Substance misuse, we're talking about that. Oral health, there's a lot of issues with the oral health with cavities and long-standing brushing your teeth. Sun safety, family, and community. So what we like to do at Catch Global Foundation with the program called Catch Health Ed Journeys is to offer all of these to teachers in a desktop format where they can just open up any one of these places and teach a lesson. And they can do it at their own pace, or they can try and pace it out throughout a school where each grade level will try and do 3 of them in 1 month period and another 3. There's also, there's just lots of activities. So the main point here is these things are interconnected, and just doing one thing might not be enough. because all these other things. And so we try to provide a comprehensive solution. We, meaning Catch Global Foundation. So how do we do it? So the Catch program formula starts with what is called social cognitive theory. This is a theory of health and health promotion that's been around for about 70 years or so. And it works towards student empowerment, norm resetting, refusal skills practice, and small group peer-led discussions. So norm resetting means, kids might have the wrong idea about how many people smoke or drink, kids their own age, or how many use fentanyl. And so that if you can get them to know what the real number is versus a heavily inflated number, sometimes they might think 80% of kids smoke e-cigarettes, when if I look at the real data, it might be 10% in a high school. What happens if you think it's 80 is that it lowers the barrier for you to try it for the first time because you think all the other kids do it. Refusal skills practice is to give kids skills so that they can say no when they're offered to smoke or do drugs, and do that in a way that they're not ostracized by their peer group. And then if you do all this sort of discussion in a small group peer-led discussion, then what happens is the material that you give to the kids, they turn it into their own culture, their own type of language, and that can vary by school to school or by race, ethnicity, geography, etc. So the kids are talking about these things and talking about ways to do this, talk about the norms, talk about refusal skills. So essentially we do with building knowledge on the left, we add skill building and environmental support. And these two elements, the skill building and environmental support, are some things that other single programs don't necessarily have. Like if you just have, if you're a school person, you just have a PE program, you're building PE knowledge, you're not building skills in other areas. So we try to connect the skills across the different behaviors, across the improvements that one tries to do to give kids healthy information across PE, nutrition, drugs, etc. And we hope, and we've found evidence that turns into healthy decision making. So another thing we do is called implementation science. And so when I develop a program, I usually think to myself, like vaping started, e-cigarette vaping started in 2011 or 12. I started reading about it. I thought this is going to be a problem. I wrote a program which is based on social cognitive theory using the elements I just talked about. We did a study where we asked teachers, do you think this will work? We asked kids, we asked parents, we got kids involved in designing the program. And then we did a study, found out it works. And if it works, then what? I can write a scientific paper in a journal, but that's not the same as really trying to get out there and being proactive. And that's really what we're talking about with Tucker's Law, is trying to get people to be proactive. And now the law makes schools be proactive about it. So that's another interesting twist. But so in the top, the science, what works, that's my job. The community, what people want, that's Catch Global's job. And the funding, who pays for it, it's also, well, it's both of our jobs. We help each other that way. Ultimately, we want to achieve impact, but you need strong evidence, strong programs. You need people in the community who actually want to work on the problem. And so mandatory trainings, we don't like doing that very much anymore. We want to find people who want to do our programs because we don't have an infinite amount of time. We can't be everywhere. So let's do it with the people who want to implement it. Because if you have a program and no one uses it, it's kind of worthless. So that's all I'm going to talk about. I'm going to pass the baton to Marcella. But I wanted you to have this QR code if you're curious about Catch Health Ed Journeys. Go ahead and look at it. Within Catch My Breath is where you might, or I'm sorry, within the drug misuse section, you'll find, and Marcella's going to talk about it, the link to something specific that we're going to give to schools about Tucker's Law and about fentanyl specifically. And so we've added fentanyl because of Tucker's Law into our collection of program activities. So just open this up and have a look at it. But let me let my screen go and give it to Marcella.
Great, thank you, Steve. Okay, just give me a second to share my screen. I am technically challenged for those who know me, so we're just going to give me 1 second. And you should, as it's loading. I want to talk a little bit about how Catch Global Foundation's resources actually meet Tucker's Law. And I'm going to go show you a couple slides, then I'm actually going to go right into the curriculum and show you what it looks like and where you can find it. So as Dr. Kelder had mentioned, Tucker's Law requires suicide prevention, the prevention of abuse and addiction to fentanyl, awareness of local school and community resources, and any processes involved in accessing those resources. And then, of course, that health education that includes that substance misuse for those youth and young adults. So what do we have within Catch's substance misuse resources? First is vaping prevention, as Dr. Kelder had mentioned, the Catch My Breath program for both vaping, nicotine, and cannabis. We also cover alcohol, prescription, over-the-counter drugs, of course, fentanyl, and then that suicide prevention module. Within those lessons, we talk about the definition of what actually is substance misuse. We talk about those avoid, refuse, and exit strategies, as Dr. Kelder had mentioned. Really having youth be able to have their own voice with youth empowerment and feeling confident to either avoid, refuse, or what is that exit strategy? How do I escape this situation if I notice that substances are being used? And then identifying what are those signs and when to call for help for poisoning and overdose. So Dr. Kelder did a great job showing us all of that information, but our young people need to know as well, because they will probably be with other young people when potentially something like this happens. So our young people need to know what does it look like and when do I need to call for help. And then also that other part of addiction signs. What does it look like to be addicted? And what are some of those resources that I can go to, or I can help my friends go to if I see that one of my friends is addicted? I'm going to share where you can find this. We've actually done the crosswalk for Tucker's Law within our Health Ed Journeys unit. And what slides actually meet the specific requirements of those 4 requirements that I had just mentioned within Tucker's Law. So talking about that suicide prevention, the warnings and signs, and how to ask for help, the prevention of abuse and addiction to fentanyl, and then following up with the awareness of local and school community resources, and then which is basically where do I find treatment, how do I get help, and then of course that health education, as Dr. Kelder really mentioned, really covers more than just the substance misuse, not just fentanyl, but vaping prevention, other identifiable drugs, whether it's over-the-counter prescription drugs, and what does that look like. So I am going to attempt to exit out of this and then go into the actual lessons themselves. So Brooks, if you can just say yes, we're good. You see?
We see it. You're
perfect.
Good.
So we do have this available on our website, which is our fentanyl substance misuse resource guide. That we will go ahead and if we can take that and put that into the chat box so everyone can take an opportunity to take a look at this information. This is where you can find everything. So how do we address student well-being? Of course, we represent our UTHealth Houston School Public Health. And then if you see down here in the green, you can click onto the Tucker's Law, which will provide you with that crosswalk that you'll have that opportunity to view in regard. It'll download. It's not going to click open to it. It downloads, and then you have that hard copy for you to look at. And of course, you can contact us with any questions. So what I would like to do is just show you what is it. Okay, we've talked about all this stuff now. What is it? How can I access it? So you'll go onto the catch.org platform. You will hit let's go catch.org. One caveat to mention, if you already have Health Ed Journeys, this encompasses all of the misuse lessons that we talked about today. So you do not have to do anything else. I'm going to, at the end of the presentation, I will share with you a link that you contact us, because if you do not have Health Ed Journeys yet, or you want to preview it, you can feel free to contact us and we can share with you a temporary registration so you can go ahead and take a look at it and see how this would actually benefit your students. So once you've logged in, you've had your catch.org account, it welcomes me personally, and then we'll go into Health Ed Journeys, because this is where the substance misuse lessons are housed. Take It's just a minute to load. I'm going to go into the middle school health journeys lesson. So you would click Let's Go. And it's just taking a minute to think. We've had some really bad storms here, so my technology is doing pretty good, and I probably shouldn't have said anything, so I probably just jinxed myself. That's a beautiful intro to our Catch Health Ed journeys, and you can preview the welcome. Where I want to go to is we talked about some of those substance misuse lessons, so you can go down here to Unit 4, Grades 7 and 8, Substance Misuse Prevention. You just click onto that tab and it'll expand out. It gives us a great introduction to what am I going to find under this tab. What are those key lessons that I need to do? And maybe I'm looking for vaping prevention, maybe I'm looking for the fentanyl lessons, where is everything at? And we try to put it right in order. So if you're looking for that vaping prevention, as we talked about, you can do the Catch My Breath lessons, which are right here and available to you to use. We talked about other substances. So as Dr. Kelder mentioned, it's not just fentanyl, it's not just vaping, it's, you know, educating young people on what's an over-the-counter drug, what's a prescription drug, and what do I need to know about that. So we have those lessons right here for you. What I love about our curriculum is that, and our program, is it's all set up and designed the same way. So if you're in Health Ed Journeys, if you're in Catch My Breath, you can see the overview. We line up the key objectives. You don't have to learn a different platform or a different scenario. We set it up exactly the same way for easy use, including if it's green, you all know if you've used our program, you click on it and you can open it up. Same thing with the presentation slides. We have our worksheets here because, of course, we believe in that youth empowerment model for students to be able to educate each other and work together on these issues that they're seeing every day that's affecting them every day. And then, of course, those key terms that you need to know as a facilitator of the curriculum. We also include those MVP challenges that Catch is so famous for, that you can have an optional extension activity. And of course, we list our Texas TEKS and National Health Standards. The educator guide, before I just go into the slide deck, the educator guide, when you click on that, since it does take a moment to download, I've already downloaded it, which is right here. And we do believe in giving script by script, so you don't have to be that expert in any of these. This one is actually for the fentanyl facts, but they all look exactly the same. So you don't have to be that expert in figuring out, what do I need to do? How do I need to do it? Here are your lesson objectives. What materials do I need to know? Those key terms, that overview. And then, of course, what we're known for is those script by script slides. So I'm going to go into now where we talk about all of this continued. First, medication and substance misuse is one lesson, then the following lesson is avoidance. So talking about those avoid, refuse, and exit strategies that they'll find out in this next section. Again, set up completely the same way. And then we have a couple other additional activities for youth vaping prevention, but what I want to go to and show you is the fentanyl lesson. So that's grades 6 through 12, and it's called Fentanyl Facts. And it's going to take just a minute. And again, it's set up exactly the same way. We have the overview, key objectives, that material prep. One thing I do want to note for our material prep for our fentanyl lesson, which is very important, is we have the parent handout. So it's the health alert, fentanyl, and your kids. We created it in black and white for ease of printing, so you don't have to worry about it being in color and taking a lot of print. You could also download it and put it onto your website so that your parents, your school's website, so your parents have resources to look out for, evidence-based resources, and a creditable resource to go to in regards to fentanyl. So here's the student lesson. We have it in our Google Slides, but you can also download it as a PowerPoint. I just suggest if you download it as a PowerPoint, to make sure you download it every time you go to facilitate the lesson, you download it new, because we may have made updates and changes. As you know, Catch really stays on top of the new latest and trends and data. So make sure you have the most current information. When you do have the Google Slides open, hopefully this will work, you can click on these little 3 dots and you can open up those speaker notes that were actually shown in the educator guide as well. We really want to make sure you have the tools and resources that you need, and not having to be that content expert. So we actually have everything scripted out for you, because we want you to be able to answer those hard questions. So it's the detailed script through just a couple of the slides as we talk about data. And it's going just a little slow, and I apologize. I'm going to close the scripts. Maybe that'll help a little bit. But what I want to show you is, remember we talked about what are those signs of overdose? What happens? What do I need to do if I see those signs? And then that medication that Dr. Kelder had mentioned, that Narcan, which is being distributed in a lot of our schools throughout Texas, so that we can help our young people if we see some of those signs and hopefully save a life. And then where we talk about those suicide warnings. So what are those key signs? What are the behaviors that my friend may be in danger or thinking about suicide? And then what can I do? What can I do for myself? And then what can I do for a friend? And then of course, those activities that we really like to talk about to engage our young people, and then breaking them out into groups and having that detailed information. And then we wrap up the whole substance misuse lessons, if you choose to, through a My Health Journey complete section where they can take a time to reflect on all of those lessons compiled together. I'm going to go to our webinar slide, potentially, hopefully, because I have just one other note that you may be thinking about. Okay, this is all great, and I know I have to access it by contacting. If we're not using Health Ed Journeys, you can contact us. But also, what does it cost anything? What does it look like? So here are our Catch substance misuse resources. So Catch My Breath is also a standalone, no-cost vaping prevention program that we offer training with that as well, both asynchronous and then fee-for-service through live paid training that's available. Our K through 12 substance misuse prevention, if you are an agency that's not a school district, but you work with schools, so your agency, maybe you're with a Department of Health or a community-based organization, but you want this substance misuse prevention, we do have that available for $99 per campus, which is an annual fee. This also includes that Tucker's Law compliance, the fentanyl lessons, everything that I just showed you under that substance misuse tab. And then, of course, for that overall health and well-being, as Dr. Kelder really mentioned, that it's not just eating healthy fruits and being physically active, but it's also, encompassing that substance misuse and how it's really a tier that all works together. And we have that collaboratively with our Health Ed Journeys. So that is $349 per campus. It meets health education through TEACS. It also meets with the Tucker's Law compliance that we talked about today. And it definitely includes all those substance misuse lessons that I reviewed, as well as Catch My Breath. The only thing that Health Ed Journeys does not cover is reproductive health, just as a side note. But then to also share with you, if you need more information or want more information, please use your camera. You can, here's the QR code, reach out to us, and we'll be more than happy. One of our consultants, experts would be more than happy to review the curriculum with you, share with you some temporary access if you don't have access to, and answer any other questions that you may have. And now I believe I'm turning it over to Brooks or Steve.
I think it's to all of us, actually. So I just want to thank both of you for wonderful presentations and taking the time to talk to everyone, and Steve in particular for sharing your personal family story. I really appreciate you being open and sharing with everyone that this affects everyone. I think we've all got stories, and I just again want to appreciate you being brave to share that, and for your family support to do that. I want to take a second to thank the people that helped get the word out about this webinar, this important topic, and who have led the effort, some of whom we've already kind of thanked and recognized, including the Office of State Representative Terry Wilson, but TAPERD, Texas PTA, Texas School Nurses Association, North Texas Athletic Coordinators, and Texas Action for Healthy Kids all really helped to get this word out, and really get a lot of people here to get this important information today. So I want to give a second for people to remind folks, we're taking your questions now. So if you haven't already submitted any, I'll give people a minute to send those in. But I did want to kind of make one point, Steve, on one of your slides. You showed heroin compared to fentanyl, compared to these new synthetic opioids. And as we've gone kind of through this, it just really stuck with me that, like, one of the important elements here is about getting people armed with overall substance misuse prevention, because if we play this whack-a-mole game, you could see how much more dangerous the things we're working down the stream, that it's, again, obviously incredibly important that we're doing this work around fentanyl, that we're getting on top of this. But if it stops with, if we're trying to play the catch-up game there, it's just getting more and more deadly and more dangerous. And what we really need to do is get upstream and get to prevention of all substances, and give students, and kids like the tools and resources to understand how to avoid substances in general. So I just thought that was a really important point that you made there. And it actually ties in with the first question, which I will say came in, someone joined a little bit late, but said, isn't it important that we also talk to kids about the other kinds of meds that may be laced with fentanyl or other drugs that kids might not even know that they're taking or smoking? How do we address that with you?
Well,
so
Steve, I think that, am I on mute?
Nope, no, I said I'll go to you first.
Oh.
Sorry.
Okay, thanks. That is an important point, no doubt about that. In that, for me as a parent, I've raised 4 kids my youngest is 22. And the world just seems to be getting a little bit scarier year after year. We've got fentanyl now that we didn't have with my oldest kids. And I have to tell my son, Ben, the same thing I put in the slide. I told him again, getting ready for this presentation. He's 22 and I'm still telling him and talking about it. And so, yes, many what look like pharmaceutical pills that are maybe for depression or ADHD or a variety of other things, it's easy to put fentanyl in them. Fentanyl can come in a powder, can come in a drop. And so that makes most, maybe all pills possibly suspect. And that's part of the curriculum. I guess Marcella can talk about that, but it's part of the educational process. I think awareness is important now, and that's why we're doing this webinar. And that's why we made the fentanyl lessons. And thanks to the Rowe family and the elected officials for requiring it. That stimulated me to want to write those lessons and to put it in this comprehensive program. But tell us about what's in there right now, Marcella.
Sure, thanks, Steve. I think being an involved parent is definitely one, because I have an 8th grader myself. So, and even though I've been in tobacco control for all of his life, I still check his backpack and still check everything that he has. So even though he's well aware. So our curriculum does cover, where do you, if someone offers you a pill or cough medicine, and we've been have that in our very young grades in elementary school, make sure you take only things that are coming from an adult. Don't take something that's from another friend. And I know that's really hard, especially, my son being in 8th grade, that middle school age, and his friends know more than I do, but I think it's just being open to have those conversations and really continue to educate our students, especially within our curriculum. And then we also have that parent piece to really make sure you only take something that's offered from a trusted adult.
That's great. This question is about why we use the term substance misuse versus substance abuse. Steve, can you talk about kind of the shift in the terminology?
It's close. You're right about that. But misuse could be accidental. It could be a bunch of different. Abuse means, to me at least, you're using it on a regular basis. That I don't know the exact reason between the two, to be honest. So that is a good point. But that's what I would say.
Is stigma a factor there? I mean, is substance abusers versus substance misuse, is it anything to do with that, or is it really about just kind of the way it's used, as far as you know?
My guess is it's vernacular, but you're right in bringing up stigma, because we as parents, I mentioned, we need to know our parents, we need to know our children's friends, and we need to know the parents. And if we suspect drug abuse on your child's friend, what are you going to do? Are you going to talk to that? Are you going to pick up the phone and say, hey, I think I've heard something that is concerning, and I'd like to talk to you about it? That's an uncomfortable thing, and it's uncomfortable because there is stigma about sticking your nose into someone else's business. But now it's so easy to overdose and to die from it that I think we have to get over it. We have to tolerate it. We need to tolerate talking to people that will lead to uncomfortable conversations, but still to try and do it in a way that point the finger at someone, but act as a resource and a support to other families.
Yeah. And I think also a point that these substances do have medical uses. So they're not just, a street drug, for example. They actually are used in, hospital settings and, anesthesia and things like that.
Fentanyl started as an anesthetic,
Yeah.
I think in the 40s, and I believe it was approved by the FDA in the 70s. It didn't turn into a street drug until what we showed at the beginning of those periods that showed the dramatic increase over time. So it's just been that type of drug that's been misused or abused in the last 20 years.
Yeah. So the fentanyl lessons that have been rolled out are relatively new. Marcella, can you talk a little bit about how long those have been out? I know someone's asking here, have we done any evidence, any research on the lessons and the outcomes to date, which they're quite new. So we haven't had a chance to do the evaluation on those lessons specifically, but maybe Marcella, you can talk about, when those lessons rolled out, and Steve, maybe you can talk a little bit about kind of the science that's gone into what's behind Catch My Breath and those substance misuse, general behaviors and kind of how those, relate.
Yeah, I would say this program, Health at Journeys and Catch My Breath, is what I call evidence informed. And so in my role at the university and as a program creator, I first look at the primary risk factors. So I look at all the peer-reviewed papers that I can get my hands on, and I review them and say, well, what's the biggest risk factor for starting to smoke? And it might be that the parents smoke, or it might be that their friends smoke. In fact, both of those are very strong predictors of whether a child's going to end up smoking, as well as their normative understanding of how many people smoke. So I go through all that process, and that can take 6 months to collect the articles, to read them, and to identify the most powerful predictors. And we did that with drugs and with alcohol. And there's a long, long history of drug prevention programs. And after I get the risk factors, then I look at what's worked in other settings. And once I figure that out, then I can see what techniques tend to work best or not in previous programs. But the world changes. And so what the literature that's 30, 40 years old doesn't necessarily apply to today's world. Then I put it in the social cognitive framework, and then I give that to my team of teachers who help me write the program. And so we work back and forth. I give them the layout, they create activities. And that's what I say is evidence informed. But yes, you're right. I would like to evaluate this, but we felt that it was urgent enough to get out, and we're using best practices and actual information that's true. So I don't feel bad about circulating it now, but yes, I would like to evaluate it.
Yeah, and just to piggyback off of what Steve said, so our Catch My Breath program is evidence-based, and it was published in a peer-reviewed study in the Surgeon General's report. So based off of that study and based off of what we know that Dr. Kelder just talked about, the social cognitive theory and the different formulations that he used, was how the fentanyl lessons were developed, knowing that that's the best practices that we have found in substance misuse prevention. Those lessons are, though, really new. They've only been out this school year. So we have not, as Steve had mentioned, and Brooks, we have not done an evaluation study on them at this time, but knowing that it was a need, and based off of what we know works in substance misuse prevention, as we do in Catch My Breath, we base them off of the same theories.
Great, thank you both. We're running short on time. I will say an attendee did chime in on the substance abuse versus misuse and shared a resource from a group called Shatterproof. It does talk about, stigma of addiction language. And so it does seem there is something to that as well. And so if folks want to look that up, we'll see if we can drop the link in for other people to look at that. It's a really interesting guide. Thank you so much for sharing that. If we've got a minute left here, is there anything else you guys would like to say to leave folks with before we let folks go? Marcella, I'll start with you and then end with Steve.
No, just thank you all for joining and really wanting to take a lead and really helping our youth live healthy lives, not only through substance misuse prevention, but physical activity and nutrition. So feel free to contact us and check out all of our resources, because we want to provide you with the best that we can to help our kids stay healthy.
And for me, with regard to fentanyl and other drugs too, it's prevention and treatment. And let's reduce the stigma about treatment. Let's prepare the physicians to be able to prescribe the treatments that work, and let's raise awareness for the prevention strategies. And we hope that you like what we presented to you, both about the facts about fentanyl and other drugs, but also about Catch Health Ed Journeys. Catch Global Foundation is a nonprofit, and there are no royalties being circulated on these products too. And so we try to do our best to keep the prices down, just to keep the staff afloat and the lights on at the business. And so anyway, thank you so much. And thanks to the Rowe family and to the elected officials of Texas, including Governor Abbott, for signing these important pieces of legislation.
And thank you to the Michael and Susan Dell Center for Healthy Living for hosting today's webinar, for all that you do to support, health and wellness of families and kids and everyone in the community. And we thank everyone here for joining today and getting this information. And as a reminder, it was recorded. We will be putting the archive up on the websites. Those will go out in emails. And again, thank you all so much for being here today. And with that, we'll say goodbye.
Okay, bye-bye, everyone.
Bye.